G'day, how you going?
Okay, Chris. So I saw you 4 days ago. That was Friday. I saw you on Friday, didn't I?
Yeah.
Okay. And did you play golf that day, or was it the next day?
Friday I played 9 holes with
That's
the wife.
right. Okay. And then will you take me through it? How's it been going with your lower back since Friday?
Things have been going good.
Hmm?
You know, like I told you, it's always the key with the exercising at home that helps. Because I do get stiff, because I played Saturday and Sunday, so 18
Friday,
holes.
Saturday, Sunday, and then you had a day off
I
yesterday.
did take yesterday off.
And today, will you play?
No, I won't
But
play
tomorrow you will.
Tomorrow, yeah.
Okay, so you've had three, well, I won't call them rounds, but you've had 2.5 rounds.
Right.
And you pulled up on Monday feeling, well, yesterday, how did it feel?
I think it was more just tired from playing in the heat, but the back was fine.
Yeah. And it was good Saturday morning and Sunday morning as well in the midst of playing?
Yeah, it's a little stiff. So I do exercises before I play golf, which helps a ton.
Yeah. So stiffness but not pain?
Yeah, no, I wouldn't call it pain.
Okay, that's good.
Yeah.
Well, let's have a look at it. I'll get you to whip your shirt off for me then. Okay, just march up and down on the spot for me. And when you're ready, you can stop there. Okay, just bend forward as far as you can there for me, all the way. Try to touch your toes. And coming back up. That's pretty good, hey, Chris?
Yeah, that's better.
Just raise your right knee, towards your chest. And down to your left.
Did you hear that correct?
Yep. To your left again. And down and do the right. Do they feel relatively the same to you, both of those knees, or was one more difficult than the other?
More difficult? No,
Pretty much the same.
Yeah.
Okay, just come and have a seat on the bench facing that way for me, please. Place your arms up like that. Twist your body to the right. Twist your body to the left. One more time to the right. Okay, let's lie you face down.
I've been having the little bit of the neck
Oh, right.
to the right.
Show me that. Just relax your arms. Turn your head to the right and to the left. You look like you're stuck to the left.
Yeah, I do feel a little stuck to the left.
Yeah.
But
Drop your right ear to your right shoulder.
Do what?
Drop your right ear to your right shoulder. That's it. Just leave your shoulder where it is. Drop the right ear. Yep. And this way. Okay.
Yeah. That's a little more difficult. I think it's the way I sleep. I'm back to being able to sleep funny on my stomach, which cocks my neck a bit.
Just drop your chin to your chest. You go all the way back as far as you can. Okay. Alright, let's jump your face down there for me. So what have you got planned today then?
Just nothing, kind of
A free day?
cleaning around the house.
Okay. That right leg is still pretty
I
short.
feel shorter today.
Yeah, it's kind of noticeable today.
Mm-hmm.
So you've asked me before, Tom, how's that leg doing? Is it catching up to the left one? And my standard response is, well, it doesn't really matter because it's going to change all the time, given the amount of golf you play, or if you think of other people and the things that they do, it might be going to the gym or sitting at a desk 24/7. There'll be lots of different forces exposed upon you, and you know that will manifest as, in your case, a twist in the pelvis in this direction, which pulls this leg up and pushes this one down. Probably got something to do with your golf swing. You know, golf is not something you can just switch from righty to lefty, is it?
Well, and it's got to be the knee, the left.
Your
knee.
left knee.
There in the left knee.
Yep, so you got. What's your history with the left knee again? You had an arthroscopy.
2 of them.
Yeah. So just wear and tear, right?
Right.
How does it feel in here, down in this bottom corner of your right lower back? Does it feel stiff?
Yeah.
Is it like a deep ache for you?
Yeah.
Yeah. That usually denotes just repetitive strain to the area, that sort of deep ache. It just means that you've really been using that area over and over and over again. If you think of the follow through in golf on a right-hander, that tendency to, as you follow through to sort of overly compress that right bottom corner of the lower back. That's why we want to do lots of this sort of stuff, just iron out that tightness. I think I told you once before, I read or heard somewhere that there's no way of hitting a golf ball without there being some detriment to your body from a musculoskeletal perspective. That's not to say that you can't perfect your technique, it's just saying that it's a very taxing maneuver. Hitting a golf ball, it's going to place some strain on your body. And if you play enough shots, ultimately there's going to be a breakdown somewhere. But still, you've got to strive for good technique all the time. That doesn't give you license just to throw it all out the window, and just hack at the ball. How does it feel through here, through that left knee? That doesn't hurt the knee, does it? You got plenty more range here, haven't you?
Do I?
Yeah.
I would believe it.
Yeah. See that difference there? It's like.
Well, like I told you, every time I leave here, my knee feels better.
From that one maneuver we've been doing.
Just the stretching we've been doing with it.
So Chris's back is basically the best word to describe it would be stiff, isn't it? Yeah. Just stiff. I mean, we don't want to put you down, Chris, but at 57, you'd expect there to be a degree of, wear and tear and stiffness, wouldn't you?
Yeah.
As much as we'd like to be 27, it's not the way life goes. What I'm doing here is I'm just starting with the actual water up here and just following on, moving my hand immediately across it, traveling over speed, just to loosen it off. This is your right side, obviously, Chris. What's it like? The same point on the left.
It's fine.
It doesn't feel as wrecked, does it?
No.
Or as used, I should say. Like there's a softer sort of quality to the tissue in through here. Probably still a little bit of a mild ache, maybe, compared to the right side.
Well, nothing like it when I first came in on the right side.
Okay, have you forgotten about those blocks you're on? That sounds like a yes. It's pretty even enough. So now with Chris's back, like I do with most of my patients, really, we're going to mobilise the pelvic joints here. I really like getting on the sacrum here and rocking on it from superior to inferior, so it decompresses the lower back. And Chris's back is, we hope it will feel good, but I'm interested to hear from you, Chris, like, because your back is quite stiff, and because of that, we may not get as big a result from you on this one, but What does it feel like to you when I'm doing this maneuver on you, when I'm pushing through your back? Does it feel like mostly a big muscle to you? Yeah. So sometimes on people who have a real lordotic sway back, we're very curved through here. When we push on this safety like this, they get a lot of relief in the lower back because it decompresses their lower back and it unbends their spine, bends it in the opposite way. But because Chris's back is so stiff, it's not as noticeable for you because it really is stiff in there. And that means I probably have to just work hard, push harder, or push for longer. Do you get any sort of decompressing type sensation around this region of your back at all from doing this? Mostly not. And what if I approach it from the different aspects of what I come from here and push down? You feel more there. So now I'm using the shelf of his sacrum, butt basically, to push down, basically pushing his lower body away from his upper body. And right here at the heel of my hand, which is around about L5, L4, we would hope to be getting some relief. Sometimes it can be painful. Is it painful on you? So, what I've learned over the years is when somebody has a really, really stiff back, maybe somebody who's over 50, doing this maneuver as a means to decompress the lower back tends to give the older patient more feedback than, say, the younger person who is still compressed. When you do this on a younger person, they tend to feel that that's enough. But then on a young person, when you're going to do this on them, like, oh, that's actually still, it's too much for them. Yeah, the older patient, this is too little, whereas that's just right. Now I'll just mix it up with some of this forced pelvic wiggling. Just pretend that the patient's like and just give them a bit of a shake. I always think of those shaker fries, with the chicken, salt, and batter fries. You just shake it around, and you'll eventually get chicken salt all over your fries. It's a strange analogy, Chris. You eat a bag of shaker fries. Yeah, that's shaker fries. See how. Okay, so now I'm going to get a bit more specific into this sort of tender right spot in your back. I'm going to go into the L5S1 facet. What's this like here on you, Chris? Is that a little bit more sensitive in terms of pain? Is it sore for you? No. Is it relieving? Or is it back to a big nothing? Okay, so that to me means that in this moment of me doing it, he's not getting a lot from it. Often people do with lower back pain. It's a spectrum. Sometimes people have back pain really bad. It's really acute and sensitive. In which case, doing something like this would be too much. Sometimes it's really, really chronic. Maybe we'll lump Chris more into that camp. He's got some chronic stiff lower back pain and he doesn't feel a lot, but I'll still continue doing it because I know it's going to be good for him. The mechanics of what I'm doing here is where I'm placing my faith in. I know that this is going to be decompressing his lower back, and as he said, generally the combination of everything we do makes him feel better. It may not be one specific thing. After a while though, it could get a bit sore, me just pounding on this one space, couldn't it, Chris? Right. Like it's quite a specific point that I want. So that was the right side. If I just compare by doing the same thing on the left, what does that feel like? Okay. there's less of an issue here, really, isn't it? So, imagine if you're a left-handed golfer, you'd be more in shape. Okay, do some more shaker fry mobilisation here. And at this point, the sense I get is that things are starting to sort of slowly switch off now, like you're starting to get more into the relaxed state, would you say?
Yeah.
For me, everything that I do here is geared around getting a good adjustment on Chris, because that for me is the climax of the treatment, is getting that nice, crisp, clean pop through his back, which, to be honest, hasn't happened a lot so far. Where are we up to? Is this like the 7th or 8th time?
This is number 8.
Number 8. This is the 8th time I've seen you in this is the 5th week, I guess. So I don't know what it is. However many weeks. A bit over a month, yeah?
Mm-hmm. Right.
But to date, it's been going pretty well, we'd say, yeah?
For sure.
So we want to keep this up. So let's do a bit more of that soft tissues work that we were doing. Lie on your left side for me. So we're going to do some active release technique here. You can just sort of relax your head there, Chris, and fall asleep if you like. Just bend both your knees for me. Okay, a bit more. Keep your feet together but the knees separated. This is the starting position, okay? So I'm just going to find the greater trochanter here, and I'll go slightly superior to it. And I'm going to push slightly down, but also take more of a tension on the glute medius. And I want you to close that knee towards the other one. You'll feel that muscle start to pull at the end, and then separate again, and then close down, and back up. And you should be feeling like a sweet pain on this. Yeah, and down, and back up. Close that knee. Bring that knee towards your chest now. You can use your right arm to hug that knee towards you. Right up. So bring the glute max into the equation. So bring that knee back to the starting position. Feet together, knees separated. That's it. Close that knee. Pull it towards you. Once in a while. All the way up. That's it. You can feel that, yeah? Okay. Separating the knees. Do 3 more. Close it down. Pull it towards you. Okay, into the start again. Separate your knees. Close it down. Pull it towards you. One more for good leg action. Close it down. Pull it towards you. Okay, and stop it there. So while you're in that position, we're gonna do that other one we've been doing.
The elbow.
That's it. Yeah. So this is your favourite. Yeah. This is to release the iliolumbar ligament, which attaches from basically the body of L5, or the transverse process of L5, I forget, and it goes to the hip bone. So it's right about in through there. And I often do this on people who I'm having difficulty getting a nice cavitation from the adjustment. In other words, a nice big click. So Chris knows what to do here. My contact point is with my thumb, right about where the iliolumbar ligament is. Okay, I'm going to support you here, Chris. Take a breath in, breathe out, twist your upper body back, find my elbow, and push nice and strong. That's it. Did you feel that little shift in your back? Okay, and relax. So you don't have the benefit of hearing what just happened then, but right underneath my thumb, I felt just this little movement, which is, if that's all we get today, that's a good thing. Breathe in, breathe out, twist back, find my elbow, push against it, and relax. That's it. So I get him to breathe in and then breathe out, because as he clears his lungs of all the air, it gives him more motion to twist back, get a bit more range. So breathe in, breathe out, twist back, push. Good work. Okay, stay on that side. We're going to finish off with a piriformis release here. Okay, so bending this knee. You okay with this?
Yeah.
This is a really good stretch, this, for piriformis.
Yeah, for sure.
Pretty much all the glutes. You know, depending on how stiff the patient is, you might even get something to the back.
Right through there too.
Yep. Or through that dorsal sacral fascia. And all of what we just did is in preparation for the big event, which is trying to adjust him, and we prepare for an anticlimax but hope for a major shift in reality here. Wish me luck here. Okay, you feeling good there, Chris?
Yep.
Breathing in for me, mate, and breathing out. Nice and floppy. That's it. Okay, and then coming onto your other side.
I don't think there was anything there, was there?
No, there was no crisp, clean pop, but you know, it's not the be all and end all, as I tell other people. Like, you saw how much, well, people would have seen on video how much force we try and put in there. Undoubtedly, we will be causing movement through your lower back.
We probably got it some other way.
Yeah, exactly. Like it all adds up. So we're going to do the same on the other side for good measure, okay? So just closing that knee down and back up. Closing down. You're putting on a brave face there.
Yeah.
Is it pretty intense?
No, it's all right.
The knee's okay?
No, this is good for it.
Okay, you got to stop me if that hurts
all
too
good.
much.
It's all good.
Okay, breathe in for me. Breathe out. Nice and floppy here. Got him. Well done, sir. Okay, line your back.
That was a good one.
That was super good.
Yeah, that was good.
I dare say that's up there with one of the best.
I think that's the first time I've really
That was very
heard it
crisp.
on that side, yeah.
All right, so on your back for me there, please, mate. Okay, we're going to do full service today, so I'm just going to get your hammies in through here. So
Great.
nice and floppy. Whether you want to call this PNF or PIR, post neuromuscular facilitation or post isometric relaxation. Push down for me. Hold your breath in, keep pushing. 3, 2, 1, and relax. Breathe out. Okay, nice floppy leg. And push down for me. Hold your breath. 3, 2, 1, and relax. That's good, yeah. Last one here. Push down. Hold your breath. 3, 2, 1, and relax. That's good. Okay, keep your legs straight. Push up into my hands and relax there. This leg now. Floppy leg, give me all the weight there. Push down for me. Hold your breath. 3, 2, 1, and relax. Okay, push down, hold your breath, 3, 2, 1, and relax. And again, push down, hold your breath, and relax. That's it, okay. All right, keep your legs straight, push up into my hand. I know people are going to be watching this asking, are those Balmain Tigers shorts that he's wearing? They're definitely not. What are they?
Oklahoma State University.
There you go. Maybe there are some people who would have even recognised that. I don't know.
My daughter went there.
Okay.
Go Pokes.
Pokes, is that what they are?
Cowboys.
Okay. All right, breathing in for me. Breathe out. And start.
Oh,
All right. I don't know how some of the chiros of YouTube get these huge pop sounds on their videos. I think they superimpose them or something, because there's no way that would have been audible, but both you and I felt it, didn't we?
Yeah, big time.
It was pretty noticeable. Okay. So turning to the left was pretty stuck, wasn't it?
Yeah.
But you said you felt it on the right. Is that correct?
Yeah, we felt it on the right.
Yeah. So often, the muscles on the right, if they're really, really tight, they won't be letting go and allowing you to complete a full left rotation. That's why you can have symptoms on the right, but issues on the left, so to speak. Bit sore in here?
Mm-hmm.
You okay with that?
Mm-hmm.
Just push your head back into my fingers and relax. Go again for me, push and relax. One more here, push and relax. That's it. All good?
Mm-hmm.
A bit stiff here today, man. Let me go here first. Okay, just relax that head there. You okay here?
Mm-hmm.
Yeah, well done. Gave you a fright there, didn't I?
Oh, I think I knew it was coming.
Okay, one more. This is the one I want to. So nice and floppy here. You okay there?
Mm-hmm.
Well done. Okay, nice and speedy. All right, I think we should do these last two standing today. So I want to give myself the best shot here. Use your body weight. That will help us out. Okay. Maybe just take one step forward for me there. That's it. Giving yourself a hug here. Okay, just dropping your chin to your chest. I won't let you fall here, okay? I'm going to pull you backwards. Breathe in for me. Breathe out. Good. Okay, and then hands on top of your head. Okay, your hands on my hands, elbows together. Breathe in. Breathe out. Okay, let's go again. Breathe in, breathe out. Just try to go really floppy through here. Okay, I'm gonna give it one more shot. Breathe in, breathe out. Okay, that's as much as it wants to go today.
I think I was kind of tightening up myself.
I think it's you did all right then. It's just yeah, sometimes you're going to be a bit stubborn here. Okay, let's we're more interested in this anyway. So let's get you to bend forward. Try and get as far as you can there. Okay, and back up. Just raising that right knee towards your chest and down, and the left. Back to neutral. Turning your head to the right and to the left. How does it feel to the left there, Chris? Better than the start? Thanks for watching. Please subscribe to my YouTube channel. Yeah, thanks mate. Good on you.